all of you right now have carboxyhemoglobin in your body? Yeah?
Yeah.
Yes?
Yes.
Why?
There's always some.
Is it because the air that we breathe is really not clean and there's carbon monoxide in the air? It's one good theory, yes. But does your normal metabolism in the human body naturally produce some amounts of carbon monoxide? Yes, it does. We can blame nature and all the pollution to a certain extent. But the normal method of metabolism in the body does produce carboxyhemoglobin. But your carboxyhemoglobin level naturally in all of us should never exceed what? Should never exceed 2.5. It has to always be less than 2.5 in all of us. Now, say some of the cooler people in the world, right, who like to smoke cigarettes.
Yeah.
What about them? Do they have a little bit more carboxyhemoglobin? Yes. How high can it go? It can actually go to about 10 to 15. Sometimes there's been report to even have 20 or 30, which is very, very high. 20 to 25 range is already big problems. So people who are smoking can actually have carboxyhemoglobin. The only question is who gets hyperbaric oxygen. So when would you decide who you're going to give hyperbaric oxygen to? When you have evidence of end organ damage, meaning the patient's got neuro damage in the sense of seizures, coma, unresponsive, that's an indication. If the patient's got evidence of ischemia of the heart, right? So cardiac injury has an end organ damage. So if somebody's having elevated troponin, ACS, arrhythmias, right? Then it becomes an indication. Now, number 3 is from a standpoint of severe carboxyhemoglobin, right? Your levels are a little too high that you need to go for hyperbaric. What level is considered a little too high? It is going to be 25. If it's 25% or more of carboxyhemoglobin, then you should be thinking of doing hyperbaric oxygen. Now, if a female was pregnant, you better worry about that at a lower level because now you've got a fetus to deal with too and the fetus needs oxygen. So if you have a pregnancy, if you have a pregnant patient, at what level should we start considering a hyperbaric oxygen? 15 to 20, very good. So 15 to 20% of carboxyhemoglobin, you need to start thinking of doing hyperbaric oxygen.